Hello, this is Brenda Montero Villanueva, and I'm here to do a presentation about a kind of contraceptive method or device, which is called the coil. What is a contraceptive coil? Well, it is a small T-shaped device that's inserted into the womb by a doctor or a nurse, and they are also called long-acting reversible contraception or LARC, which are the most effective forms of contraception. There are two types. The first one is the intrauterine system, IUS, also known as the hormonal coil. Second one is intrauterine device, IUD, also known as the copper coil. They're both T-shaped, and then the difference is that the hormonal coil is made of plastic, while the copper coil is made of copper and plastic combined. The hormonal coil reduces a hormone called progesterone, while the copper coil releases, as the name suggests, copper ions. Now, the hormonal coil is commonly known by their brand name like Mirena, Livocert, Hyalina, or Jadis. And the IUD or copper coil has a brand that is also known as Paragard. So this uh, is how they look. So on the left side is hormonal coil that's made of plastic, and the other one is made of copper and plastic combined. And you can, as you notice, there are two strings below the device, which is then being used by the doctor when the device is going to be removed. We'll discuss that later. So how do they actually work? So progesterone. Well, since the hormonal coil releases progesterone, as it's been discussed in the part one of this activity, it is a hormone produced by a female reproductive system that plays a crucial role in preventing pregnancy by creating an environment in the uterus that is unfavorable for fertilization and implantation of a fertilized egg. And the copper, sperms don't like copper, and it prevents sperm from reaching an egg. It also helps change the lining of the uterus and cervical mucus, making it less ideal environment for sperm. So how is coil being inserted? The fun part. First, the doctor checks the patient's uterus for size, position, and any signs of infection of pregnancy. Then, a speculum is used to get a clear view of the cervix and clean the area with antiseptic. Next, the cervix is stabilized with a special tool, and the depth of the uterus is measured to ensure the device fits correctly. The device is then preloaded into a sterile inserter, and then the doctor carefully inserts the device through the cervix into the uterus. Once in place, the coil is released and the inserter is gently removed. Finally, the doctor trims the threads so just a small length is visible. When it's time to remove the coil, the doctor pulls on the threads with a special tool and a new coil can be inserted if needed. It is also important that the thread is all or the IUD or IUS is always in place. So the doctor or the nurse who inserted this to the patient will then explain how to regularly check if it's still in place. So basically, these are the three easy steps. First, the hands must be cleaned. Second, the female should find a comfortable place to sit or squat. Third, the patient should insert the middle or index finger into the vagina until the patient feel the strings coming out of the cervix. So what happens if the patient cannot feel the thread? There's no need to worry. All the patient needs to do is to schedule an appointment with the health provider and use a backup birth control in the meantime. The health provider may ask for a pregnancy test. If the strings can't be located during the pelvic exam, an imaging test may be ordered. A pelvic ultrasound is often used to locate the IUD if it hasn't been expelled. Once the IUD is found, the healthcare provider can remove it, and if desired, it can be replaced with a new one. So these are the common questions that patients ask the doctors about the coil. How long does a coil last? Depending on the type, it will last between 3 and 10 years before it expires. When can a coil be fitted? Copper coil can be fitted at any time during the menstrual cycle, and it protects against pregnancy immediately. The hormonal coil should ideally be fitted within the first 7 days of the start of the period. However, if it is fitted anytime uh, during the cycle, the patient need to use another form of contraception, such as a condom, for 7 days. Is the coil fitting process painful? Having the coil fitted can be uncomfortable, and some people can find it painful. Paracetamol can be taken, or a patient can ask the doctor or a nurse about having a local anesthetic beforehand. If pain or discomfort is felt when it's being fitted, the patient should let the doctor or the nurse know, as they can be asked to stop at any time. What are the side effects of having the coil fitted? After the coil is fitted, the patient may get period type cramps. There may also be some bleeding or after a few days of having the IUD or IUS fitted. But the patient need not to worry because this is completely normal. Can the coil be removed if the patient change mind? If the patient no longer wants the coil or it reaches the expiry date, this can be done at any time by a trained doctor or a nurse. Now, who shouldn't get IUD or IUS? The patient with the following condition or situation shouldn't get an IUD or IUS. It is not advisable for them: abnormal pap smear test results, abnormal uterine bleeding, acute pelvic inflammatory disease or PID, cervical or uterine cancer, current or recent history of pelvic infection, current STI or sexually transmitted infection, higher risk of STIs, history of previous IUD insertion without removal, hypersensitivity to device components such as copper, pregnancy, a very large or very small uterus. So here is the summary of all the things or the comparison between a hormonal coil and a copper coil. If the patient cannot decide, she can actually compare the two here. I wish I have more time to discuss each, but this is a bit of a reading for if you want to have a look at it. It discusses the type, how it works, effectiveness, duration, effect on period, hormonal side or hormonal side effect, non-contraceptive use, and which is it best for. But if the patient really cannot decide which one to choose, here is something to think about. If a patient values a hormone-free method, and is comfortable with their current periods, then the copper IUD could be the perfect match. Or if a patient would welcome lighter, less painful periods, or even none at all, and could benefit from the other health perks of progesterone, then the hormonal IUS might be the ideal choice. So it really depends. If the patient has some side effects using hormones or pills, then IUD would be suggested. But if the patient has a heavy period and would want the period being lessened or no periods at all, and she has no problem taking hormones, then the hormonal IUS is really suggested for the patient. So that's it. And thank you for your time and have a nice day.